Hi, welcome to this month's team brief. I hosted it today. Suzanne's having a well-earned day off. We had a number of items today on the team brief. We heard from Louisa Daly, who works in the patient experience team, about the fantastic results we've had from the inpatient survey and all of the good work we've been doing in relation to our patient experience. We also heard from Jonathan Spinks, who works in the IT department, and he talked about the rollout of Vital Pack, which is an IT observation kit which is going out into the wards. Bob Peat, who is our Director of Strategy, updated us on where we are with the merger proposal with Royal Surrey. And finally, we heard from Valerie Bartlett about the work that she's been doing in partnership with the CCG around improving services in North West Surrey. At the beginning of the team brief, I did a plea and I asked staff to think about whether or not they'd completed this quarter's Friends and Family test. You will know that we're required to do this every quarter, where we ask you about your experience of working for the Trust, whether you would recommend us as a place to work and whether you'd recommend us as a place to be treated. And we've had quite poor response rate this quarter, so again, a plea to you to complete it. It's an online survey. It'll take you about 5 minutes, and as an incentive this month, everybody that completes the survey will go into a draw for £50 worth of John Lewis vouchers, so there's a little bit of an incentive for you as well.
My name is Louisa Daly and I'm Head of Patient Experience and Involvement. I was really pleased to come to Team Brief today and talk to everybody about our fantastic results that we've had on the inpatient survey. What I wanted to try and get across was the phenomenal improvement that we've had. We've actually moved up 66 places nationally. From 143rd we were ranked nationally in 2013, and we've moved right up to 77th position now. So the key areas that we've really improved on this year, it came across in the areas that really matter to our patients, which is having really good communication from our doctors and nurses and feeling involved in their care and the decision making. We've actually improved on 45 questions out of the 60 that we're ranked on, and we've stayed the same on 8, and only marginally gone down on a few areas. So moving forwards, we're actually going to be sampled in July for our next patient survey for 2015. So there'll be lots of communications coming round to let all the staff know. We're going to have posters up in all the wards to make the patients aware that we will be asking them potentially to give feedback on our service. So the key message is obviously to carry on doing what you're doing so well, but be aware of things like noise that we're making at night, and let's try and control the things that we can control, and also trying to help patients understand at the point of discharge what's going to happen, what medications they are going to be taking, and what may happen beyond their point of discharge. But other than that, really the message is just to say congratulations to everybody at Ashford and St Peter's. Everybody's instrumental in this phenomenal improvement, and we'd just like to see this continue and hopefully move up another 66 places and be 11th next year. Thank you.
I'm Jonathan Spinks. I work in the Health Informatics Department as a Senior IT Project Manager, and I was talking today to Team Brief about our new Vital Pack project. This is a new system we'll be rolling out across the wards over the next few weeks for collecting nursing observations. The project starts on the 29th of June on May and Cedar Ward, and the new system will enable the nurses to collect those observations electronically on an iPod Touch. The data will be visible across the whole trust to clinicians. It calculates an early warning score for the patient and will generate an alert when that patient deteriorates. The automation of this will be very good for our patients in terms of safety. Vital Pack will replace the paper observations chart, and we will be providing training on the wards as we roll it out. It's very intuitive to use and should be very exciting for the Trust.
I'm going to update you about progress with our proposed merger with the Royal Surrey County Hospital at Guildford. The first thing to say, I think, is that the rationale for that merger is, if anything, stronger than it ever has been, given the current context in the NHS, the need for delivering financially and clinically sustainable services, and the need to deliver 7-day working across all our services, as well as ways to recruit and retain our staff. What's been happening over the last 3 or 4 months is a phase 2 review by the Competition and Markets Authority, who is a key economic regulator in this country, who's reviewing whether or not the merger should proceed or not. And just last week, key members of the executive team attended hearings with the Competition and Markets Authority, where we put forward the case why we thought the merger would benefit our patients in this part of Surrey. What we're expecting next is to get what's known as provisional findings from the Competition and Markets Authority. They're going to be published, we hope, by the end of July, and will give us a sense of where the regulator has got in understanding the level of any lessening of competition that will arise through the merger. Following that, we're due to get the final outcome of that regulatory review currently in mid-August, and that will give a decision on whether or not the merger is going to be cleared to go forward or potentially blocked. If the merger is cleared, we then have to bring a business case back to our boards for approval, and subject to that approval, subject to that clearance by the CMA, we'd then be looking to re-energise and restart our planning work about integration and delivery of that merger, probably for some time in the middle of 2016.
Hello, I'm Valerie Bartlett and I'm the Deputy Chief Executive and Director of Transformation. And today at Team Brief I've been talking about better health, better care. So this is a project with our local clinical commissioning group, North West Surrey. And what we're doing in this project is we're having a look at the future health needs of our local population. And from that we're trying to understand what range and type of services we need to have in the future to best meet those needs. So this is one of a range of strategic projects that we're looking at as a trust board, and what we're aiming to do through this project is produce a set of recommendations by the end of July, and this will help the board look at all of the options for the future of the trust and this could be either an alternative to the merger if for any reason that doesn't proceed, or it could well be something that we decide to do as well as the merger.